There are actually several important roles for health information exchange and healthcare reform. One actually would be patient-centered medical homes would actually need health information exchanges to be in place to actually exchange information among physicians and specialists due to the requirements of healthcare reform for these homes. One of the major requirements is that information be available in real time to support specialists and physicians, and also with requirements for accountable care organizations, which is a demonstration pilot under healthcare reform. These providers will actually be judged on their use of that information that is exchanged. Another way is the use of eligibility checking and claims reimbursement data, which will need to be exchanged among entities. Eligibility checking data will be exchanged using a new standard called HIPAA 5010, which will add a significant depth of data for providers to actually give to payers and give those payers actually more data to analyze in terms of determining eligibility for specific programs. And with regards to enrollment and with regards to claims reimbursement, there's also additional need to exchange information among providers and among providers to payers to ensure that people can enroll in the programs they are entitled to, and also ensure that the claims process is more efficient. And then the last way health information exchange really plays a role in health reform is through comparative effectiveness. And what that is it's actually collecting evidence-based information about care that's been delivered, and then using that information to actually capture and look at trends in terms of treatments to determine what are the best options for treatment. And this is really used in terms of healthcare reform to look at cost and determine how costs can be lowered and controlled. There are actually several challenges that HIAs will face over the next few years. One of the major challenges is related to sustainability. And sustainability is really about their business model. How do they plan to make money? How do they plan to actually go beyond the grant funding that's been provided by the federal government and the state governments over the past couple of years, which will eventually run out. And that really is accomplished through the use of low value and high value services. Low value services being more of the exchange of information that's done every day, such as lab and radiology results. And then higher value services where you might need to identify a set of patients, or you might need to actually exchange information only with a specific provider that may be outside of the HIE. HIEs will need to find a model that works for them in order to generate some level of income. Tied to that is the business plans of the actual HIEs. In many cases, commercial HIEs tend to design their business plans to provide just the capabilities their stakeholders need, and that community is very small. Versus state HIEs tend to really focus on a much larger community. They look out actually for the interest of the entire state, and they tend to offer or tend to actually ask for all the capabilities that can be provided. And in that case, it's very difficult because it can be difficult to meet that timeline of actually bringing those capabilities to the market. A third issue related to that is that in order to actually provide these capabilities, you need to make sure the stakeholder community is engaged. So the providers need to be involved, you need to have their buy-in, and they need to actually be actively exchanging information in order for the exchange itself to work. And then the last case and the last challenge that they're really going to deal with is these plans and these state HIEs have really been developed in isolation. And if you look at an example like the Interstate Highway System, which was a state-based initiative as well, all 50 states worked together, but were provided federal funding for that. HIEs have been developed a little differently. Each state is developing it on their own, and in the end, they're going to actually need to make sure that each of their exchanges work together across state lines to share patient consent and to make sure information can be exchanged across state lines as well when patients move across states. Technology is actually going to play a very large role in fraud, waste, and abuse. It's actually one of the major priorities of this administration, and going forward with healthcare reform as it's implemented will actually become a major priority for cost control for the administration as well. One of the first areas technology is used in is to actually analyze and collect data. And how that's done is, currently we collect a lot of the information in a paper-based format, but as we move towards an electronic healthcare system, that information will actually be available in large data sets that can be looked at and analyzed for trends. Currently, recovery audit contractors do that for Medicare and actually look at information, look at claims, and analyze trends to determine overpayments. And they're also able to look at that information and determine whether it's actually a fraudulent claim, meaning the person actually intentionally wants to misrepresent the claim, or if it's just a matter of oversight. It's going to be very important in terms of cost savings to make that kind of determination. And also for Medicaid, with Medicaid integrity programs, both at the federal level and state level, it will be similarly important as well. The last area, though, actually is very important with fraud, but also with just the general waste within the healthcare system, is comparative effectiveness research. What that is used for is actually to analyze evidence-based information that's provided actually from patients and from providers, and would actually be analyzed by CMS, by other government agencies, to determine what the most effective treatments are. And in that way, CMS would actually be able to control payments to providers by making sure that they're prescribing the right treatments that are needed versus just prescribing treatments based on their own opinions. The National Information Exchange Model, commonly referred to as NIEM, is actually a very important sea change in the paradigm of health information exchange. Currently, a lot of exchanges that are done can be done in a standardized way, but the standardization that occurs is more just of what kind of content is being sent. And what NIEM is trying to really focus on is, let's actually standardize these exchanges based on the business context that is used between multiple participants. And the first example of that will actually be on the Nationwide Health Information Network. NIEM is actually being chosen because it's actually been used in the law enforcement and emergency management community for a relatively long period of time, especially related to federal, state, and local departments. And what they've done is they've actually been able to exchange all different types of information associated with those communities, and done it in a context that allows them to quickly share that information. And one of the big success stories that NIEM uses is Amber Alerts, which are information collected by local governments, but also by state governments as well, which can quickly provide information across state lines, and that information is of tremendous value. And the plan is to use that in a similar way for the Nationwide Health Information Network, in that you would be able to exchange information between participants on the NHIN, in a very quick fashion, but also be able to do that in a way that's very standardized, so that that information can also be processed very quickly as well. And it can be done for similar types of situations where you can use it for day-to-day information exchange, such as lab results or clinical summaries, but also for situations in an emergency, such as population health information as well. The paradigm has not been tested in healthcare, but it's actually a very important change, because it finally will create a system where information exchange can be standardized. And it also is going to be done in concert with standards development organizations that have developed the current set of healthcare standards, so that they're intimately involved in that approach.